Thank you, Tom, and good afternoon. I'm pleased to report today that more than 7,400 Albertans have now recovered from COVID-19. We've conducted almost 7,200 new tests in the last 24 hours and have identified 41 additional cases in the province. Currently, 41 people are in hospital, 9 of whom are in intensive care. We know that this virus can spread easily from one to many. One area each in Calgary and Edmonton are currently on the watch list, with more than 50 active cases per 100,000. No additional measures are needed in either area at this time. However, we are watching closely those cases. Also today, we are listing new outbreaks linked to 4 restaurants in Edmonton: the Greta Bar, Earl's Tin Palace, the Pint, and Local on Jasper Ave. Alberta Health Services is working closely with operators to facilitate testing and ensure all necessary steps are taken to protect public health. We are encouraging anyone who attended any of those locations in the last 2 weeks to get tested. I want to reiterate that these restaurants and those who have been tested are doing the right thing by taking steps to contain this outbreak. As I have said before, it is critical that we do not shame those who test positive, but rather support them to isolate and work with public health to do contact tracing and follow-up as these restaurants have done. Tomorrow is Canada Day, and rain or shine, I know that many Albertans are looking forward to celebrating. I encourage everyone to find creative ways to celebrate, including virtual events. As announced earlier this morning, we have now expanded the gathering limits for audience-type outdoor community events for those who wish to gather in person. Effective today, gatherings of up to 200 people are allowed for audience-type events like watching fireworks, festivals, rodeos and sporting events, and outdoor performances. When Stage 2 of our relaunch began, we committed to reviewing the situation in Alberta every 2 weeks to assess whether our measures were appropriate and if any changes could be made. Today's change is the first such recommendation that we brought forward to the government. We are making this shift based on several factors, including an analysis of how the virus is spreading in Alberta and the reduced risk of gatherings held outdoors. We believe that if organizers and attendees take appropriate health measures, including distancing between households and cohorts, it is possible to conduct these events safely. However, more people does not mean less care. All public health measures are still in effect, and I want to urge all Albertans gathering in groups to take these seriously. Participants still have to stay 2 meters apart or wear a mask. They will have to wash or sanitize their hands frequently. Seating for these audience-type outdoor events must maintain distance between families or cohorts. No one who feels sick should attend any gathering of any size. They should stay home and arrange for testing. Only by observing these measures can we all help prevent the spread while staying socially connected this Canada Day and beyond. There are no changes to the participation limits for indoor gatherings or private celebrations. Indoor social gatherings still are limited to 50 people, and indoor seated events remain at 100. Outdoor, private, and social events like weddings, family reunions, or funerals remain limited to 100 people. If you are planning a private gathering in your backyard or home for Canada Day, keep it within your cohort. Or if you have guests outside your cohort, only invite as many people as your yard can hold while maintaining 2 meters distance between people from different households. You also want to think about cleaning and sanitizing doorknobs, faucets, and bathroom facilities partway through the gathering if people from outside your household are using them. And you should also have hand sanitizer available to your guests. Hold off on any gathering if you are uncertain as to whether or not you can follow the public health guidelines. COVID-19 will not take a break because it is a holiday. Please refer to our guidance documents at alberta.ca/bizconnect to know how you can help reduce the risk of COVID-19 in any setting. We must all continue to take proper precautions. For those who may be getting away to a summer cottage or a campground, Please respect the health and safety of small communities along the way by planning your trip without stops for gas or food where possible. We must continue to take all necessary precautions to protect our health and the health of those around us. Holidays can be a difficult time for some, even when we're not in the midst of a global pandemic. Many Albertans out there feel alone, are afraid, or are unable to go out because they are at high risk of infection. I encourage all of us to reach out to members of the community who may be in this position. To close, I would like to wish all Albertans a happy and healthy Canada Day holiday. And that includes the officials who work so hard to update the daily COVID numbers. They will also get a well-deserved day off tomorrow, so the next update on case numbers will be on Thursday, July 2nd. It takes specialized expertise to pull the data and compile the reports. Our teams have been working 7 days a week for many months now. I have said before that this virus will be with us for many months to come. We must all adjust to our new normal, and so after Canada Day, we will shift to providing daily updates Monday through Friday, giving the reporting team weekends off. We will continue to provide daily breakdowns, reporting on Monday so it's clear how many cases occurred each day, and we will keep Albertans fully informed. If urgent news breaks on a weekend, we will alert you. With that, please enjoy your Canada Day and stay as safe as possible. We continue to all be in this together. Thank you, and I will now take questions.
All right, we'll go to the phone now. Operator, could you put through the first one, please?
First question is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. Can you please be more specific when you explain your logic around lifting the cap for outdoor gatherings to 200 people? Was this done specifically for Canada Day? And what events will happen tomorrow that couldn't have happened before you lifted this cap?
This change happened as a result of our commitment that every 2 weeks following the beginning of stage 2, which happened 2 weeks ago Friday, we committed to looking at our numbers, looking at our epidemiology, and then coming back with any changes that we felt would be appropriate to happen. And so looking at our numbers, looking at where transmission has been happening, what we've seen is that the vast majority of transmission that has been occurring has been happening within social settings, especially within social gatherings or sometimes work gatherings where people are close together, most often indoors where they're not 2 meters apart, not wearing a mask. We have not seen significant transmission within outdoor, more structured or seated type events. We know that being outdoors does reduce the risk of transmission. And so when we were looking at the different types of activities that would be possible as we looked at how we can move forward with respect to stage 2, the ability to expand those more structured audience type community events is something that will allow Albertans, not just for Canada Day, but going forward through the summer, to participate in things that otherwise would again have been restricted to that 100 maximum. So it is very specific to those more structured, again, audience type community events where you don't have a lot of people mixing and mingling in a smaller social environment. And again, that was because the risks that we've seen both here in Alberta and looking at the evidence of spread in other countries and other provinces, those more structured outdoor events don't seem to be the source of much transmission. And we felt it was safe to be able to expand the numbers in that very specific context, along with all the public health guidance that remains in place for those larger seated community audience events.
Operator, can you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. How many cases are linked to the outbreaks at the 4 restaurants in Edmonton? And in regards to the Calgary apartment outbreak, what are the latest numbers there? And what's your advice to those living in apartments and condos about how to stay safe?
Sure. So the 4 restaurant outbreaks, we have at this point 15 cases associated with the Greta, 6 associated with Earls, 10 associated with the Pint, and 9 associated with the Local. With respect to the high-rise apartment, at the moment we have 49 cases. 33 active and 16 recovered in that particular location. The important thing, again, to note is that this particular outbreak is still under investigation as to the cause. And I want to really commend the residents of this building as well as management for the work that they've done with public health to make sure that the safety measures that are being put in place in this building are highly effective at this point in terms of high cleaning of high-touch surfaces, making sure that people are wearing masks if they're in an area outside with people outside their household cohort, and that they're not able to keep the 2 meters distance. So at this point in time, again, I want to be clear that there's a lot of work happening in that particular area with respect to people who live in other high-rise apartments and what we can say in terms of risk. Again, while we don't know with absolute certainty at this point the cause of this, we are looking at various possibilities. One of the possible sources is, again, high-touch surfaces. And so I think that people who are living in a multi-story building or perhaps working in a multi-story building just need to think about when they're leaving their particular unit, how they'll be able to stay distant from others if they're not going to be able to stay distant. So for example, if they're going to be in an elevator with others outside their household, then wearing a mask can help mitigate that. Making sure if they're touching high-touch surfaces like railings, door handles, or elevator buttons, that they hand sanitize immediately afterwards. And again, working with the apartment or condominium or office tower owners to ensure that there's high cleaning of high-touch surfaces, all of those basic things that we've talked about, but each individual can, again, take those precautions for themselves and work with their neighbours and management to ensure that collectively those are the precautions being taken. We do have office tower guidance. We also have guidance for multifamily dwellings or kind of condominium or apartment style buildings. And so I think if anyone's looking for specific guidance on our website, they can find those documents that help outline any other measures that might be useful in those settings.
Operator, can you put through the next question, please?
Next is Bill Fortier with CTV. Go ahead, Bill.
Hi, Dr. Hinshaw. I'm just, when you crunch the numbers here over the last week and you take the average number of new cases in every province across Canada, Alberta has the second highest rate to only Ontario. So, you know, it could be said that Alberta is a bit of a hotspot right now, the second highest in Canada. How do you reconcile that with, you know, easing up on more restrictions? I know you say people are safer outside, but I think some people would question if it's time to be opening up these restrictions more at a time when Alberta is now among the worst provinces in Canada for new infections.
One of the things that's really important to consider as we're looking at our new case numbers and we're comparing with other provinces, part of what's important to remember is the testing strategy that we have. So both Ontario and Alberta have a very broad-based, very aggressive testing strategy. When we test more people, we will find more cases. We also need to look at whether or not the cases that we're finding now, how many of them are linked to a known source and how many of them are coming from the community where we don't necessarily know where the source was. And at the moment, we are seeing, certainly we are having some community transmission where we still are investigating and haven't yet determined a source. But many of our new cases we're finding linked to outbreaks that we know about. Not that we would want those outbreaks to happen, but at least we can explain, we understand where they're coming from. People are coming forward to be tested, and that gives us the opportunity to break those chains of transmission. And so, again, the rationale for increasing the gathering size in very specific contained outdoor settings, or structured, I should say, structured outdoor settings, is that those settings are not settings that we've seen transmission happen in a significant way. So it's really important for people to be able to distinguish the risk of being indoors in social events where they're not distanced, not wearing masks. That's really where we see that transmission. And so it doesn't really make sense to keep restrictions on, for example, these structured outdoor gatherings where we don't see a lot of transmission simply because we are seeing that transmission in other settings. I want to remind Albertans, though, that collectively we have the power to make our relaunch successful by following public health measures, and that it is really critical that even as we expand the numbers, we cannot let go of the need to distance, wear masks when that's not possible, make sure we stay home and get tested when we're sick, and of course the regular hand washing, not touching face, all of those things, because that's how we will be able to continue this successful relaunch. We will be watching the numbers over the next 2 weeks. And again, it's up to all of us and how we behave every day as to whether or not we will be able to continue easing restrictions or whether we're going to have to pause. Because again, if we do continue to see growth in cases and whether or not that leads to growth in hospitalizations, if we do see an acceleration, then that would be cause for concern. So again, this is in our hands and we can make this relaunch successful. And those cases that we're seeing over the last week or so, again, we can explain most of them, and the dynamics that are driving that transmission are not related to, again, the outdoor structured audience type events.
Operator, can you put through the next question, please?
Next is Brenna Rose with CTV. Go ahead, Brenna.
Hi, Dr. Hinshaw. I was wondering if you could explain why the limit for weddings is still at 100 and it wasn't bumped to 200, even for, outdoor settings or ceremonies where people could be spread out.
When we were looking at the outdoor gatherings for which we felt that we could increase the limits, even though weddings, again, we have in an indoor context differentiated between wedding receptions and wedding ceremony, where the wedding ceremony is allowed to have 100 indoors and 50 for the ceremony. We didn't make that same differentiation outdoors, again, because of the concept of that social gathering. And I think the more you create opportunities for people who know each other to gather together, as opposed to more the community type events, where it's more, for example, going to watch a fireworks display. You can have families at different distances from each other, kept separate by that 2-meter distance, where they're there to watch a common performance or say watch a fireworks display, but they're not there to socialize with each other. And a wedding ceremony, while the main purpose may be to watch that ceremony, it's very difficult to then stop people from socializing who know each other in that context. So we have kept private gatherings like funerals, like weddings, to that limit of 100, even in an outdoor context, because of that added element of social interaction that's very difficult to minimize in those kind of private gathering contexts.
Operator, can you put through the next caller, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. Where are we at in terms of restrictions, visitor restrictions in long-term care homes? How is the province monitoring that? Any easing of those restrictions? And then also any thoughts on Toronto's indoor mask policy?
With respect to visitor restrictions, we are looking at the feedback that we got. We did have several thousand participants on our telephone town halls last week from operators, families, residents, and staff of continuing care facilities. We got a lot of really good feedback, both by those who participated filling out advanced questionnaires, as well as their feedback on the line. And then people did also have an opportunity to provide comments afterwards. So we are looking at all of that feedback and trying to do our best to pull together again those two tensions, needing to make sure that those particular high-risk settings and people who live in them are protected from COVID-19 outbreaks and the possibility of severe outcomes, and at the same time making sure that people who live in those settings are not experiencing the devastating impact of isolation, as we've heard from so many people, has been the effect of the visitor restrictions. So we need to make sure that we're listening to all that feedback, that we have a chance to incorporate it. And within the next several weeks, we anticipate we will have an updated visitor policy to be able to, again, do our best at a next step to strike a better balance between COVID protection and protection from the effects of social isolation that the policies have introduced.
Operator?
Oh, sorry, there was a second question about Toronto masking. So this Toronto, as I understand it, is moving forward on a masking policy for indoor spaces, public spaces. And I think this is an example of where municipalities have the ability to look at their own local epidemiology, their local circumstance, and if they feel that a particular measure is appropriate in that particular context, then municipalities have the opportunity to go forward and put that in place. We are, of course, provincially continuing to encourage all Albertans to wear masks in public indoor spaces, especially where they're not able to consistently maintain 2 meters of distance from others outside their household or cohort. And we are, of course, providing masks through various venues, such as to municipalities to enable them to use that on transit and other distribution mechanisms so that people have access to masks when needed. And so we are recommending that Albertans take this same approach, again, using masks when they are inside crowded indoor spaces to limit the potential for spread of COVID-19.
Operator, can you put through the next question, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Hi, Dr. Hinshaw. In terms of these outdoor events that can now have more people, I'm curious about how organizers are expected to manage safety at places where people kind of can't help to congregate. I'm thinking about like entranceways, concessions, washrooms, things like that. I'm also looking at places like Nunavut, which have had no cases yet, and today they just upped their outdoor gathering limit to 50. So I'm wondering how we reconcile that with the number of cases we have here continuing to go up and expanding the numbers with a place that has no cases and is still so contained.
So I want to be really clear that organizers of an event who don't feel comfortable with being able to manage the public health restrictions for an audience of 200 should not feel any pressure to expand to that number. Organizers of events can absolutely set a lower limit as the number that they feel comfortable that they can manage, as that, again, is their prerogative. So the upper limits, again, are never a requirement. They're simply a ceiling. So organizers can look at our outdoor gathering guidance. It has several lists of suggestions for ways in which organizers can manage to use prompts to remind people to keep distanced. For example, lineups for the washroom. Are there ways that you can put prompts at 2 meter intervals to remind people where to stand when they're lining up? But ultimately, really, it is up to the organizer to think about how they will be able to maintain those public health measures and then set the maximum attendance at the limit that they feel comfortable being able to maintain those measures. Because that is the expectation, again, for any of these gathering limits. The expectation is that the public health guidance will be part of the planning for any event to make sure that the risk of transmission in those settings is reduced. With respect to comparing the gathering size limits to other jurisdictions, each jurisdiction has to consider its own specific context and make decisions about how they will manage a particular transmission event. I can't speak for Nunavut and the reasons why they have decided to have their limits where they are. I will note that Nunavut as a jurisdiction has challenges that we don't have in Alberta with respect to the number of, for example, intensive care beds or access to intensive care hospital beds and their ability to manage a large outbreak where they may be. Again, if there is an exposure at a particular event, then contact tracing would need to happen. That could involve, again, if there are 200 people at an event, if there is an exposure that involves many of them, then jurisdictions have to have the capacity to be able to do rapid contact tracing and to be able to manage several cases if there should be transmission. So again, I can't comment on the reasons why Nunavut would have made that decision, but I just will note that we have a different context here than they have in Nunavut with respect to our ability to contact trace large volumes of contacts from an exposure, as well as having infrastructure that may not be possible to access easily in some of the smaller jurisdictions.
All right, I think we've got time for 3 more. Operator, could you put through the next one, please?
Next is Emily Mertz with Global News. Go ahead, Emily.
Thank you. Just hoping that because we didn't hear about deaths that there have been no COVID-related fatalities today. And then my question is regarding recovered cases. How does Alberta Health keep track of cases that don't end up in hospital? Does a public health nurse call them after the 14 days to get an update on their condition or symptom to list them as recovered? And then what circumstances would a person have to be tested and require those 2 negative results in order to be listed as recovered?
You're correct on the first question. We have had no new deaths today. With respect to the second question about how we keep track of recovered cases, we do that in 2 ways. So public health does follow up with cases to make sure, again, that they understand the need to be isolated with their symptoms. But in terms of keeping track of our administrative counts and how we know who's recovered versus not, that's a bit more automatic. So what we do is we look at the confirmed cases who've been diagnosed, and then after a particular period of time, as long as they are not admitted to hospital, we have no record that they have had a serious illness, again, that they haven't been in hospital or required ICU care, that they haven't passed away, then at that period of time, they would be deemed recovered, so that kind of gives them a little bit of leeway past the 10-day clinical resolution time period to make sure that we're counting them as recovered. So that's in addition to the public health follow-up. But we wanted to take a bit of burden off of local public health, who's doing a lot of work on the front end. So we're not requiring an individual certification of recovery. For our administrative systems, we're using our systems to be able to track that. And we don't require 2 negative swab results for recovery at this time. The reason for that is that we now know that people can shed the virus for many weeks after they have recovered. And when someone is shedding the virus after many weeks, although it can be detected, it is not considered to be infectious, so that virus would be dead. So even though you can pick it up on a swab, it wouldn't be able to be passed to someone else. So it is no longer that helpful to require those 2 negative test results, because someone could be shedding virus for a very long time, not be infectious to others, and still potentially be testing positive.
All right, operator, could you put through the second last question, please?
Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. I'm wondering if you can provide an update on the MISC cases that we're seeing in Alberta, the additional probable cases that are being looked into since that first case you announced at the end of May. So wondering, have you been able to confirm those? How many as of this afternoon? And then what is your level of concern based on the numbers of MISC that you're seeing here in the province?
Thank you for that. We have had 4 cases now of MISC reported to us. Based on our case definition, which is very broad at this point, we are considering that all 4 of those cases meet our case definition as confirmed cases. But I will note that in this particular surveillance of this particular condition, we have left our definition broad enough to include even those cases where they do not have a confirmed case of COVID, or they do not have COVID positive serology. So what we're trying to do at this moment is keep a wide enough net that we can capture as many cases as possible. So while they are confirmed from our current definition, again, that definition does not currently require a diagnosis of COVID-19, because we want to make sure that we don't miss any cases in this early information gathering phase. What we're doing right now is working with the federal government and other provinces and territorial partners to make sure that we have consistency in reporting across the country. And so through those discussions, we may determine whether or not there's a need to narrow our case definition to be more specific to COVID. But at the moment, again, we are keeping it broad to make sure we don't miss cases. What I would say about the trending in that, having 4 cases, is that it isn't surprising to have 4. We know that this particular condition is similar to other conditions such as Kawasaki disease, and there could be some crossover in the cases that we're getting. So again, it's through this work with the federal government and provincial and territorial partners to determine whether or not we need to narrow that a little bit to look specifically at COVID cases. And I would say that the good thing is that all 4 of these cases have recovered and are no longer needing hospital treatment.
All right, operator, could you put through the final question, please?
Final question is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thank you. Dr. Hinshaw, I'm wondering if when you come out with the new long-term care visiting rules, whether they will be incremental, sort of like what we saw last week with acute hospital visits, or whether you're sort of waiting these extra several weeks to make a more sweeping change.
We haven't made final decisions yet on exactly how we will implement the changes. We're again looking at the feedback that we received from many, many stakeholders and trying to determine how we can best accommodate all of the needs and perspectives that we heard. What I think will be important and what we heard clearly from the feedback is that different settings and different groups of residents may need slightly different approaches. So we're looking at how we can accommodate those interests, because not all groups of people who live together in the same household are at the same level of risk. And so that's one thing that we're trying to work into the updated framework. What I will say also is that whatever changes we make in this iteration, our approach to COVID remains based on best current evidence, remains based on our current situation and epidemiology. And so we will continue to seek feedback and adjust as needed going forward. So this will be unlikely to be a final change, but we are hoping to be able to create a framework that does bring better balance to those needs for social connection and connection with loved ones, as well as protection from infection with COVID.
All right, thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon. Have a safe Canada Day.